am Dr. V. N. Indulatha, Vice Principal, Sree Abirami College of Pharmacy. Pleasantly welcome you all to this webinar entitled Principles of Toxicology. Welcome you all. Naturally, I have to start with warm wishes and hearty welcome to our guest of honor, today's webinar speaker, Professor Dr. R. Vadivelan sir from Department of Pharmacology, JSS College of Pharmacy, Ooty. He is a renowned personality, eminent speaker in the field of pharmacology. I am very much happy to welcome you all to this webinar, sir. Welcome you, sir. It is my great privilege to welcome our respectable chairman, Dr. P. Pereswamy, sir, to gracious to this webinar. Welcome you, sir. It gives me immense pleasure to welcome our board of directors, Dr. M. Kundavidevi ma'am, Dr. R. Senthil Kumar sir, and Dr. B. Balamurugan sir. Welcome, sir. Welcome, ma'am. I extend my gratitude to welcome our principal, sir, Professor Dr. M. Senthil Kumar, to inaugurate the session. Welcome you, sir. I have to take this opportunity to thank all our delegates who participated in this webinar and thank you all for joining with us for this webinar entitled Principles of Toxicology. I wholeheartedly welcome you all to this session. Welcome on and all. Now, I hand over the session. Now I call upon our principal, Dr. M. Senthil Kumar sir, to open up the session with brief introduction to our eminent speaker. Please, sir.
Thank you, Dr. Indulatha. See, very pleasant morning to one and all. The present is here. On behalf of the management and the faculty team and the students of Sree Abirami College of Pharmacy, we wholeheartedly welcome you all for this national level webinar series 2. So thank you for joining us for now today in the webinar. And before I start the scientific session, I would like to say brief about some of about our institution. So the Sree Abirami College of Pharmacy starts established in the year of 2017 with B Pharm and D Pharm. We are annual intake of B Pharm 100 intake and 60 intake in diploma in pharmacy. So and the webinar which we started initiated, this is the second webinar series we are planning it, especially this session, this webinar we planned for most of the pharmacy students, those who are studying in 6th semester, 7th semester and regular paper, have a subject of pharmaceutical, principles of toxicology. So the toxicology subject, we want to enlighten to all the students. So we request our expert, Dr. Vadivelan, to present the particular topic to make much aware about toxicology. So the toxicology is one of the key area in molecule development. If you go for any research and development area, it's a key area. Definitely, if you are a graduate in pharma, you should know much more about the basic principles of toxicology. So the toxicology, as you know well, ultimately the aim is to the right amount of the dose, right amount of the area to minimize the side effect or toxic effects. So toxicology, we should know that must be every pharma graduate must aware of this particular topic. To minimize the toxic effect, there is new technology has been started nowadays of like nanotechnology. Many areas are they are started doing it. And I could say simply the word, the old drugs with new cloths. So the old drug with new cloths is a concept of eliminating of the toxic effect of the therapeutic agents. So ultimately, the improve the therapeutic efficacy, we wanted to have reduced the side effect is the main phenomena of any molecule development and product development. So definitely it's going to be interesting topic to all the pharma graduates, all the pharma experts and the healthcare sector people. And definitely will be after the seminar, definitely you will come to know the basic ideas about the toxicology. So with this brief, with this brief, I would like to introduce today's speaker, expertise in pharmacology area. Now I introduce Mr. Dr. Vadivelan. Dr. Vadivelan completed his graduation in pharmacy and post-graduation in specialization of pharmacology from Tamil Nadu Dr. MGR Medical University, Chennai, Tamil Nadu, in the year of 2000 and 2002, respectively. He has been awarded PhD in Pharmaceutical Sciences from JSS University, Mysore in 2013, and also recognized as FIC from ICS Kolkata, and also he completed FEFLASA accredited CCLAS course at TANUVAS Chennai. He got around 18 years in the professional experience, and the area of research is endocrine and cardiovascular pharmacology. He has received grants like a national workshop on alternatives to animal testing in drug discovery on the September 2nd and 3rd. He's the convener of the workshop in the year of 2013. And there is a 2 days workshop on applications of CAL techniques in experimental pharmacology as an alternative to animal testing. It was conducted on 21st and 22nd of August 2015, and he has received a grant around 1.70 lakhs. And also he has conducted NAM and S&T, Center Research Training Fellowship for the Developing Country Scientists, the award fellowship in the year of 2015 and 16, and also he has received 2.70 lakhs. He has made around 22 presentations. He has published 58 national and international research publications and authored one book. It's entitled He has delivered more than 15 lectures in various institutions in the area of preclinical pharmacology. He guided around 25 PG students and 2 PhD scholars. He is the president, Indian Pharmaceutical Association, Nilgiris branch, and also is a life member of Indian Public Health Association, Indian Hospital Pharmacist Association, Indian Pharmaceutical Association, and Laboratory Animal Scientist Association. And also he has significant contribution as a principal investigator. He carried out many consultancy work like preclinical studies such as DATIS, dermal toxicity studies, etc. And also one of the prestigious is a CBCSEA nominee. So with this brief, I'm happy to welcome, it's my privilege to welcome Dr. Vadivelan to present today's topic, the principles of toxicology. Turn out to Dr. Vadivelan. Now it's your time. Go ahead, please.
Yeah. Thank you, Dr. Senthil Kumar sir, for giving a brief introduction about me and in my research expertise. And I thank all the management, the faculty, and the team of this webinar series of Abirami College of Pharmacy for conducting this second series of webinar. So as I mentioned to you, today my topic is related with principles of toxicology. As I mentioned to the principal, saying that it will be useful for BPharm students, where those are studying in the 6th semester, exactly the 4th unit, which you called as principles of toxicology. So therefore, my topic, as I want to mention it clearly, it is exactly the topic which is to be covered in 12 hours. I am going to give the glimpse of 1 hour just by covering the topic and making the student to understand before going for a preparation of exam. And I have introduced some of the regulatory agencies such as OECD guidelines, also how they are coordinating with it. So to start with my topic, the slides to share, as I mentioned, it is same as that as the syllabus of PCA prescribed, unit 4 of pharmacology 6th sem. So to go with the introduction with the principles of pharmacology, the toxicology, and 3 types of toxicity studies such as acute, subacute, and chronic toxicity, and special toxicity tests such as genotoxicity, carcinogenicity, teratogenicity, and mutagenicity. And then an idea about some of the general principles of treatment of poisoning, and then clinical symptoms and the management of barbiturates, morphine, organophosphates compounds, and then finally touching with the lead, that is heavy metals and antagonists. Mainly these three heavy metals, that is lead, arsenic, and mercury. These three things we are going to discuss. To start with the introduction, so we all should know the basic thing. What is toxicology? So as a principal mentioned, nowadays it is very important area. We should know about the toxic effect of the drugs. Yes. So whenever a new drug comes to the market in any formulation, either it may be nano formulation. So first thing, we may be knowing an idea about the efficacy of the drug. Fine. But at the same time, it is essential to know the toxic effect of the drug. That means at what dose level or at what duration or at what exposure the drug is going to produce its toxic effect. So therefore, we can know the human endpoints of that dose. So for that is the way how we are going to learn it. So to start with logy, toxicology, the logy word we know that is study. Toxicon means poison. So in a simple terminology, we call study of poisons. So that is the symbol which is indicated for the poison. So in a broader manner to define toxicology, it is the study of adverse effects of chemical substance. So there is a difference between a side effect and adverse effect. So always you will be getting a side effect with the efficacy of the drug. So adverse effect is, it may be a toxic effect also. So therefore it is adverse effect of chemical substances on living organisms and the practice of diagnosing and treating exposures to toxins and toxicants. So in simple terminology, we study about those adverse effects and we are going to find out what are the cause of those adverse effects, and then we are going to know how we are going to treat those toxins or toxicants. So that is the thing, it is being highlighted. And if you see toxicology, as they mentioned, which predicts the effect or the efficacy of a drug, it is the relationship between the dose and its effects. It's the relationship between the dose and its effect. And there are some various factors which are associated with it. So as I mentioned, the first thing is the dose. So if you take any drug, the dose will decide whether it is a drug or a poison. The dose will decide whether it's a drug or a poison. So the other factors which includes the dosage form, the duration of exposure. That's what we are going to study. What do you mean by acute, subacute, subchronic or chronic? And the route of exposure. So there are different routes of exposure. So each route has its own advantages and disadvantages. The species, what type of species, the age, the sex, and the environment. So all this plays a major role in toxicology. And who are the experts who are going to study about the toxicology? You call them as toxicologists, where they are the experts on. Yeah?
Can I have a pause? Your the display is not coming. Can you pin it? And presentation, can you pin it?
Yeah, it's not coming. Yeah, I'll stop sharing.
The presentation. Now you present it.
Now, 1 second, should I go?
Only your video is coming, and on the slides we had supposed to pin it.
Yes, slides. I think it is coming. No, is it coming now? Yeah, you're presenting table. Is it okay?
Yes, sir.
Yeah, it's okay now.
Okay.
Now only it is showing. Yeah.
No.
No, go ahead, sir. Go ahead. No problem.
Go ahead, sir.
You know, is it clear right now?
Yes, sir. Yes, sir.
Yeah, pin it.
Yeah, pin it என்றாங்க.
Madam,
ஹைட் பண்ணுங்க.
ஹைட் பண்ணுங்க. ஹைட் பண்ணுங்க. F5 கொடுத்துருங்க. இப்போ கொடுங்க F5 கொடுங்க.
தெரியுதுங்களா?
Right.
Hello?
தெரியுதுங்க.
Can I speak now?
Yeah, you can go ahead, Dr. Vadivelan. It's clear now.
Okay, thank you.
Yeah, sorry for the disturbance. Sorry, please go ahead.
Yeah, okay, fine. So those persons, you call them as toxicologists who are the experts on poisons and poisoning. Nowadays, a new area where we call it as evidence-based toxicology, where we are having the consistently and transparently some of the scientific evidences for the toxic effect of the drug and how it is being diagnosed and how it is to be treated. That is based on the scientific evidence. So that you call nowadays a growing field which you called as evidence-based toxicology, that is EBT. And coming to the history of toxicology, how it has been evolved, and who is called the father of the modern toxicology, and how he coined the word toxicology, that is the dose. So the first, you can see a Greek physician which you call Pedanius Dioscorides. He is a Greek physician from a Roman Emperor Nero, made the first attempt to classify plants according to their toxic and therapeutic effect, where he has been written in a book called Der Materia Medica. And another person you can see, Matthew Joseph Bonaventure Orfila, is always remembered as Spanish toxicologist. He is the first founder for the science of toxicology, where the formal treatment taken in 1813 in his books called Trite the Poisons, and it is also called as Toxicology Generale. And then in 1850s, Jean Stas became the first person to successfully isolate the plant poisons from human tissue and nicotine. Then we always remember another person, a scientist called Paracelsus, who's called the father of the toxicology, and the full name is Theophrastus van Hoyenheim. He's the person where he coined the word, that is the dose makes the poison. The dose makes the poison. Still, we remember Paracelsus as the father of modern toxicology for his coining the term, the dose makes the poison. Therefore, the dose plays an important role in this pharmacology and toxicology effect. And coming to the terminologies, so always we have a mild confusion. Moreover, it sounds the same. That is toxicant, toxicant, and poisons. So if you are just defining them, toxicant, if you see, they are manufactured and extracted chemicals such as pesticides, cleaning agents from industry or emissions or byproducts. And toxins, if you see, they are the naturally occurring poisons either produced by living organisms such as bacteria, fungi, plants, insects, or algae. And poison, it is a toxicant that cause immediate death or illness in a very small amount. So that is the difference between a toxicant and a toxin. So another a broader way you can see they are synthetic chemicals, they are naturally occurring chemicals. So that is the main difference. And they are introduced by the environment as a result of internalization or from industrial chemicals. So they are synthesized from, as I mentioned, from plants, fungi, animals, or from chemical elements. So you should have an idea of what is toxicant, what is toxin, and what is a poison. As I mentioned, the father of modern pharmacology, that is Paracelsus, he coined the word, the dose makes the poison. Yes. So it is a quantitative relationship between the concentration. So what is the concentration of that poison that you call the term xenobiotic in the body and the magnitude of the biological effect it produces. So what is the quantity taken and how it has been exposed and what is its efficacy, toxic effect in a biological membrane. So that plays an important role. So if you see this picture, you can see that where it explains the two branches of toxicology, meaning the toxicokinetics and toxicodynamics. So what is the paradigm here? So the dose which is entering into the cell membrane, that is the internal concentration. As we learn in pharmacokinetics, it undergoes absorption, distribution, metabolism, and excretion. So that is the process with a toxicant or a toxicant, you call it as toxicokinetics. And then after PK, we call the PD. So say here we call them as toxicodynamics. So when it goes and bind to a receptor, that is the TA is the association constant and TR is the dissociation constant, and it becomes active and binding to active target site, and then only it produces the effect. So that terminology you call it as toxicodynamic. So this part also should be understood. So that will be useful for what the dose and what is the relationship between the concentration and magnitude. See here I have just given an example. You see the beneficial effect and see the toxic dose. So we all know the wonderful drug aspirin. So aspirin is used as an antiplatelet agent, and it is used for an simple for as a painkiller. It is being used as non-steroidal anti-inflammatory drug. So the beneficial dose of aspirin, if you see, it is 300 to 1000 mg. And same if you see the toxic dose is 1000 to 30,000 mg. That means the dose decides whether the drug is having a beneficial effect or it is having a toxic effect. Same, the vitamin A. So nowadays you see there are plenty of effects of vitamin A. I think in COVID-19 also, every houses from the primary health centers they're giving with the zinc and vitamin A supplements. So normally it is having the immuno stimulant activity. Okay. So therefore, if you see the 5,000 units per day is the limit. When it is crossing of a toxic dose 50,000 units per day, it may produces the toxic effect. So therefore, to decide whether it is a beneficial or a toxic, the dose decides it. And you can see the same thing, vitamin A, when it is having a lower dose, it may lead to blindness, dry skin, or increased infections. And when it is too high also, it may cause anorexia, anemia, nosebleed, muscle and joint pain. So this is the threshold level. So either too low or too high, it may lead to the unwanted effects. Therefore, the dose should be within the limit to produce the beneficial effect. So this is the key concept in toxicology. And to generally have the various branches or types of toxicology, so here there are various branches where it is existing nowadays. So one you call it as the mechanistic toxicology, where we'll be learning the effect of that is here we use the word toxicology means the toxic effect of the drug and cell and biomolecular level, and descriptive toxicology. So here we'll be learning the toxic effect of the drug in various descriptive terms. So that is in vitro, in vivo, in situ, and in silico. And nowadays, most important field, it is called regulatory toxicology, where they frame the rules and regulations for a toxic substance. And then another term you call it is the forensic pharmacology, where it is been useful in the case to know what is the cause of the death. Mainly it is used in the medical field. And then the other thing is the environmental pharmacotoxicology. It is related with the ecotox to see the toxic effect where non-human toxicology, where it is affecting the living organisms. And then once again, another improvement field you call it is the clinical toxicology, where you are directly studying the toxic effect on the human volunteers. And then you call the term as developmental toxicology, where you will be seeing the toxic effect of the drug along with that embryo. We all know the thalidomide disaster that we will be learning the tetragenicity, and what is the effect of the drug on the male and the female reproductive systems. So it is by named by different branches of toxicology. And next coming to the types of exposure and effect. So coming to its effect, as we are going to learn, either it may be acute or a subacute, subchronic or chronic. So acute means always it is a short term where a single exposure lasting less than 24 hours, and subacute again further duration has been increased, exposure for 1 month or less. And then subchronic, so when you come to acute, it may be a single dose within 24 hours. Then it's coming to the repeated exposure of the study. Subchronic means it is up to 1 to 3 months, and then chronic means it's a long term. Exposures are essentially for the lifetime of the species, more than 3 months. So these are the four types of effect. Generally, we call acute, subacute, and chronic. And types of exposure. So that is in what ways this toxin or toxicant or the poison is being exposed in the body. The first thing, it may be the local, that we, as I mentioned, it may be through the skin or it may be through the mucous membranes. Second one, by the systemic, it is through the systemic circulation of the body for the various organs. And cumulative. So normally what happens when you are giving a drug and when it is not eliminated from the body, and once again you are giving the drug, so what happens, it gets accumulated in the body. So sometimes it's essential for us to know the half-life of the toxic substance in the body. And next come to the poisoning. So once normally it gets accumulated, what happens? It is distributed to the various parts of the body, and then it may be producing the poisoning effect. So that is called the local, systematic, cumulative, and poisoning exposure of a toxicant. So the routes of exposure, as I mentioned, there are four routes of chemical exposure. That is absorption. That is the first thing which I mentioned. And then it comes the inhalation, and then ingestion and injection. So dermal exposure, inhalation, ingestion, and injection, these are the four major routes. And it is the time to be known, that is how long an organism is exposed to a chemical is very, very important. And the duration, what is the duration and the frequency contribute to the dose. This both may alter the toxic effects. So always the frequency of giving is very important. That's what I said. Normally, if you take a drug, we should know in a day we may be giving 2 times or the 3 times, or sometimes we may be giving 1 time in case of an antibiotics. So that plays a major role where it may alter the toxic effects. And as I mentioned, to acute means its exposure usually entails a single exposure, and chronic means we are exposing it to the multiple time. The frequency has been increased. So therefore, the route of exposure and time of time are also considered to be important. So just we have learned some of the brief introduction about what is toxicology, what is the history of toxicology, and what are the terminologies of toxicant, toxicants, poison, and what is the route of exposure, and what is the type and effect. So this is a brief introduction. Now, what are the various regulatory guidelines for conducting these toxicity studies? So in different countries, they're following some different regulatory toxicity guidelines. And the most which is followed by the member countries is for the toxicity studies, mainly for the preclinical trials, is OECD, that is Organization for the Economic Cooperation and Development. So with their one of their important guideline, that is testing for chemicals. And the other one is the International Conference on Harmonization, that is quality, safety, efficacy, and multidisciplinary, that is ICH guidelines we call. And then in the United States, there is another thing, Environmental Protection Agency. And in India, we are following the Schedule Y, that is CDSCO, Central Drug Standard Control Organization, where they've enforced the law in India has been, that is along with the Drugs and Cosmetics Act 1945. So today what we are going to discuss with that types of toxicity studies is acute, subacute, and chronic, with their guidelines is from OECD. So if you see as per your syllabus of PCI for the topic, so just they given the definition and the basic knowledge of these toxicity studies. And if you're in a higher level or a PG level, then it is essential for you to know in detail about those guidelines. So in my further slides, we will be discussing the name of the guideline, what is their principle, and what is their procedure in a very brief manner. So we have learned the 3 types of toxicity studies, how far it has been exposed. So the first one is the acute toxicity study, where we are going to observe for 14 days. And subacute toxicity studies, the next level, that is observed for 28 days. And subchronic toxicity studies, it is observed for 3 months. And chronic toxicity studies is observed for 6 months and 2 years. And the remaining, which I call is the genotoxicity, or mutagenicity, carcinogenicity, teratogenicity, they all are called as a special toxicity studies where they are having a different guidelines to be followed. So before going with these guidelines, previously, that is before existing of this alternative to toxicity studies, LD50, that is lethal dose 50. This was used as an indicator for acute toxicity studies previously, where we go with some 5 to 10 groups, in each groups of 10 animals, and we will see in which dose level the 50% of the animals have been killed. So what happens, this study is having a disadvantage that within a short period of time, we were using a large number of animals, and the large number of animals, the mortality ratio is also very high. So therefore, the two old and traditional methods which were being used previously were graphical method, that is Miller and Tainter method, and then the arithmetical method you call the Carber method, where we use the small numbers. So this is the way where the graphical representation is being given. And for example, this LD50, as I mentioned to you, we are taking some 10 doses up, for example, from 0 to 10, and we'll be able to extrapolate and we'll see in which dose. This is the dose, in which dose the 50% of the animal were killed. So here you are using more number of animals and the mortality ratio is high. So therefore, these OECD guidelines, they have brought some 3 acute oral toxicity studies method, that is the alternative methods, where they have used minimum number of animals. So initially the guideline 401, they have used some higher number of animals. Then they brought the 3 guideline for you to understand, that is 420, 423 and 425. So what is this acute toxicity study? What is the purpose and rationale? So this acute toxicity study is to study the effect of a single dose on a particular animal species, and it may be carried out in 2 different animal species. One may be a rodent and another may be non-rodent. So more specifically, they say you can go with a rodent as per the OECD guidelines. And in acute toxicology testing, this IND product is administered at different dose levels. So for example, they mentioned 5, 50, 200 and 2000. And the effect is observed for 14 days. That means we are having the pre-specified fixed dose levels. And then all the mortalities, for example, during the study are recorded, and along with their morphological, biochemical, pathological and histological changes in dead animals are also investigated. That means during this study, the animals have been dead, or at the end of the study, the animals are sacrificed and it is been observed for all these morphological, biochemical, pathological and histological changes. So the one important thing we should know is we are going to give a single dose in 24 hours, and then we are observing it for 14 days. So what is the information this acute toxicity study is going to provide for us? The potential. So how far the drug is having the efficacy for the acute toxicity in humans, and also to estimate the safe acute doses for humans. And for example, what is the potential target organs of toxicity, and the time course, the time needed for the drug-induced clinical observations, and the appropriate dosage for the next, for example, the subacute or the subchronic studies, and is there any species differences in toxicity. So this is the information we will be gathering from the acute toxicity study. So without this acute toxicity study, we will not be performing the either subacute or subchronic study. So sometimes the study, the global harmonized system, we may stop the study in the acute toxicity itself based upon the mortality of the animal. And normally, if you're seeing the OECD guidelines, this is the protocol will be given. So I'm not going to explain in detail. You can just go into the OECD website. You'll be having everything. The introduction with the purpose of test. They describe the test procedure with the principle, and preparations comes with the experimental animals. That is, how are you going to select the species, the number and the sex, the housing and the feeding conditions. So the housing and the feeding condition, It will be common for all the studies. And the dose levels and the observation periods, this will be varying from acute, subacute, and chronic. And the procedures also will be varying: the clinical examinations, the pathology, and assessment of toxicity in other sex, and data and reporting. So we have to report in form of treatment of results, evaluation, and test report. So this is a simple protocol. So as I mentioned, the three acute oral toxicity methods, we will have a brief description about the principle. So one method, the first method we call FDP, that is the fixed dose procedure method as per OECD 420. And the other one is the ATC, that is the acute toxic classic method 423. And the other one is the UDP method, that is the up and down procedure of the OECD 425. So normally, as I mentioned, they prefer with the young adult rats or mice with one sex. Dosing type, here it is single bolus dose. It's common for all. As I mentioned, it is only a single dose. As we mentioned, it is a oral toxicity study. The dosing route will be oral only. Observations, the clinical observations, body weight follow-up, as I mentioned. Sighting study. So sighting study is required in order to confirm the dose level for the main study. So we are having two types of study. One is called sighting study. The other one is the main study. So normally sighting study will be done with either only one animal. So in the case of 420, it has been done. And the methodology, if we see, as I mentioned, it is pre-specified fixed dose 5, 50, 500 and 2000 mg per kg. So normally we start with a lower dose. So there is a separate flow chart. Initially, we have to start with 5 mg per kg. We are using 3 animals or 5 animals based on the procedure. So normally we will be seeing the death of the animal based on the globulus RNA system. We will be repeating it once if it is two death, or if it is a single death, we will be going with the higher level. So that is in the case with 420 and 423. And in UDP method, we are going to start with the estimation of for LD50 with a dose of 175 mg per kg. And the estimation, as I mentioned, all we are going for the estimate the LD50. So everywhere the necropsy has been done, and the endpoint is signs of acute toxicity in target organs. So these three alternative methods are considered to be very important for any substance to know a toxic effect. So normally, what are the parameters we may observe? That is the clinical observation. In that also, the first 4 hours are considered to be very important, continuous up to 14 days. It may be with hyperactivity, paleoerection, twitching, irritability, jumping. So many parameters. Normally, whenever you're going for a primary screening, we'll be going with all these observations. Mainly based upon the toxic effect, you can see some of the observation, whether it is hyperactive or whether it is overexcitation or a seen a stimulant or a depressant. Sometimes if it's a toxic effect, it may produce a labored breathing followed by cyanosis. And if the death occurs in between, we may find out what may be the reason for the death or what is the target organ in which it is been affected. So this is about the acute toxicity study. Subacute. So these studies are conducted to evaluate a new drug's potential adverse effects following a treatment period for 2 to 4 weeks. So here it is a repeated dose where we are going to give the drug up to the duration of the study. So here we are going for the range finding studies. That is, it is very important, this range finding dose study, where it will be helping us to determine the MTD, that is the maximum tolerable dose of a drug product. So normally we will be selecting some 3 to 4 dose levels. Sometimes we may go with a low dose and medium dose and high dose. So in the case of the acute toxicity studies, we are having a pre-specified fixed dose, but here we may go with a low dose, high dose, and a middle dose with a control animal. So to choose the dosage levels to be used in the subsequent subchronic and chronic toxicity studies, so this subacute toxicity may be preferred. As per OECD guideline, we have to remember it is 407, 28 days study. The purpose of the study to assess and evaluate the toxic characteristics of the chemical, the determination of the oral toxicity using repeated doses. So that is single dose. Here it is a repeated dose may be carried out after initial confirmation of the toxicity has been obtained by acute testing. And the principle says here that, as I mentioned, it may be a graduated doses to several groups, where one dose level per group for a period of 28 days. And the remaining procedure is we have to observe it closely each day for signs or symptoms. And the animals which die are killed during the test are necropsed. And at the conclusion of the test, surviving animals are also killed and necropsed. That is for a 28 days studies. And the protocol is the same as I mentioned to you. The number and sex animals may vary. So there we may go with 3 to 5 animals maximum per group. I will say 423 guideline, we are going 3 animals per group. In 420, we are going 5 animals group. So in subacute toxicity, the animals number is higher, and the clinical and the biochemical parameters also it has been improved. So for example, here you can see 10 rats per each dose level, 5 male and 5 female, and if needed, we can go with the additional satellite group, where this group we are not going to sacrifice the animals at the end of the study. We are going as such. And the dosage, we are having the 4 groups of control group and at least a 3 test group, and a limit dose is always be followed of 1000 mg per kg, and administration is oral. So we are going to see the observations, body weight and food water consumption, hematology, clinical biochemistry, pathology, gross necroscopy and histopathology. So this protocol will be same for the subchronic or the chronic study. Only the number and sex of the animals may vary along with the biochemical parameters. Sometimes in chronic studies, we may go with the interim level also. Next, coming to a 90-day study, this is called the subchronic toxicity study, that is OECD 408. The purpose of this is to arise repeated exposure over a long period of time. So previously it is for 30 days, here it is for 90 days. And this provides information on major toxic effects, indicate the target organs and possibility of accumulation. And it also can provide an estimate of NOAEL, that is no observed adverse effect level, which will be helpful for selecting the dose levels for chronic studies and establishing the safety criteria for a human exposure. The principle is same, only thing the duration is for 90 days. So graduated dose level to several groups of 90 days, we are observing the signs of toxicity, and at the conclusion or the end of the study, we are going to sacrifice the animals and it is necropsy, and the surviving animals are also been killed and necropsy. And next, coming to the 90 days toxicity study, OECD 408. So it may be available for rodents or also non-rodents. So here it's specifically for the rodents. So here if you see 90 days, the difference is previously we are using 10 animals. Here we are using 20 animals at each dose level. That is 10 males and 10 females and additional satellite group. And we are using control under at least 3 test group, that is a low dose, a middle dose and a high dose. And then if you're going to see the pathology or the gross necroscopy and histopathology, the same, and we're going for the data reporting. So coming to the chronic toxicity study, what is this purpose of this chronic toxicity studies 452? So this may be carried for example, minimum from 6 months up to the lifespan or minimum up to 12 months. So this will be helpful for identification of the chronic toxicity of a chemical and identification of the target organs of the toxic substance, characterization of the dose response relationship, and also identification of a no observed adverse effect level, that is NOAEL, or a point of departure for establishment in the benchmark dose, the prediction of chronic toxicity effect with the human exposure level, and a provision of data to test the hypothesis regarding the mode of action. So this chronic toxicity is having the major advantages and benefits related with the human's dose. And the principle, as I mentioned, it is a orally administered daily graduated dose to several groups of 12 months. And sometimes it may be shorter than that. It is based upon the regulatory requirements and it should be justified. And sometimes it may allow any effects on cumulative toxicity also with the proper justification. And any deviations from exposure duration of 12 months should be justified. And one or more interim kills, that is, for example, we may take more number of animals. So here we are going with 40 animals, for example, with 20 males or 20 females. Some animals may be killed at 3 months, 6 months, or the 12 months. That is called the interim killing for knowing the hematological or the biochemical or any changes in the pathological level also. So at the end of the test, the surrounding animals are killed and necrosed. The same protocol where we are going for 40 rats, as I mentioned, is the 20 males and 20 females and additional satellite group. So that is uh,
Hello? Sir, audio is cut.
and here it is for definition having some of the basic effect. So it
Dr. Vadivelan,
cell
just hold up for a minute. Sorry. We'll be back shortly due to the technical error. Hope the speaker will be back and he will continue the presentation. Please be patient and there may be a technical issue. Hope he'll be back to continue the presentation.
Sir?
மேடம் இல்ல எனக்கு பிரசன்டிங் கொடுக்கல, இப்ப ரங்கநாதன் இஸ் பிரசன்டிங்னு வருது.
ஓகே ஓகேங்க சார், நான் அவரை இது பண்ண ரங்கநாதன் சார்.
மேடம்
சார்
நீங்க
வெளியில
வெளிய
போயிட்டு
வந்து
வெளியில வந்துட்டு இருங்க சார், சார் உள்ள வந்துருவாரு.
நீங்க வெளிய வந்து ஒண்ணு மேடம்.
கூகுள் மீட்ல இருந்து வெளியில போயிடுங்க சார் நீங்க.
யார் நானா? இல்ல இப்போ உள்ள
இல்லைங்க
வந்து.
சார், ரங்கநாதன் சார்.
ஓகே.
Now, Vadivelan, you can start with sorry for the interruption.
Okay.
A few slides before you can join, please.
Okay.
Sorry.
Sorry for the interruption. I think.
Sorry, just a minute, Dr. Vadivelan. Sorry for all the delegates. So there is interruption and telecommunication issues. And now I request Dr. Vadivelan to resume his chapter what he is presenting. Sir, please go ahead, sir.
Okay, thank you, Dr. Sorry once again for the interruption. And as I mentioned, we have discussed about the different types of toxicity studies with the acute, subacute, and subchronic. And then we were entering to the special toxicity studies to have the basic knowledge and understanding. Starts with the genotoxicity. So these are the chemical agents where that damages genetic information within a cell, causing a mutation. And I mentioned some of the examples such as alkylating agents, polycyclic aromatic hydrocarbons, and glycophyllins. And these are the various guidelines as per the regulatory OECD, either in vitro or in vivo mononuclease assay or chromosomal aberration. Mutagenicity refers to the complete, for example, causing a genetic mutation, that you call it as a genetic alteration, or where it is causing a permanent alteration in the nucleotide sequence of the genome of an organism, or a virus, or extra chromosomal DNA, or genetic elements. So the various sources may be physical, chemical, or biologicals, where we know about the radiations, pollutions, and some virus. And these agents which are producing this mutation, you call them as mutagens. So there are a difference between the genotoxicity and mutagenicity, as I mentioned. The genotoxicity, where it is having the ability to destruct the agent or destruct the genetic information. Mutagenicity, where it is having the property to cause the genetic mutation. And we call by the name as genotoxin and mutagen. The relationship between these both is that not all genotoxins are mutagens, but all mutagens are genotoxins. So the effect, if we say it is having the genotoxicity, that is the destructive effect on the genetic material of the cells, and mutagenicity, it brings the change of the mutation in the genetic material. And carcinogenicity, the agents which causes cancer. You know what are the cancer cells which is being shown, where it is having the abnormal cell division or abnormal growth. So this carcinogen are some of the agent such as heavy metals or virus or fungi, where it will be directly involved in the exacerbation of cancer or in increase of its propagation. If you see any genotoxic or a carcinogen, may be having a direct effect or indirect effect on the normal cell, and it may damage the DNA or affect the DNA replication and may cause mutation, and this damaged DNA may cause the apoptosis, cell death also. So this picture clearly shows what are the various mechanisms in which our body is being exposed to carcinogens, causing a genotoxic mechanism or a non-genotic mechanism, leading to a hypermutability or gene instability and apoptosis, causing to the cancer. And the other special toxicity study you call teratogenicity, that is the agents which cause them are called teratogens, where they are causing the production or induction of malformation, especially of a developing embryo or a fetus. So I was explaining about the special field nowadays. You call them as developmental toxicology. And one of the historical event to be remembered about the teratogenicity is the thalidomide disaster, the tragedy which has been occurred in Europe during 1960s, where thalidomide is a drug given for sedatives and hypnotics for a pregnant woman, and they have seen that the newborn baby were with this phocomelia, that we call with the sealed limbs. So therefore, a teratogenicity test is also considered to be important. So the dose matters with the alcohol or the heavy metals. So these are the 4 types of special toxicity tests to be remembered. So one is your genotoxicity, mutagenicity, carcinogenicity, and teratogenicity. For all these special toxicity tests, there are different guidelines with in vitro and in vivo studies as per OECD. And then next coming to a glimpse in general principles of treatment of poisoning. So what are the measures can be taken to be known? They follow different methods, but what are general principles generally followed? So first we should try to identify the poison and to ensure and maintain a clear airway and ventilation. So you call it as ABC, airway, breathing and circulation. And if there are any convulsions, try to suppress it, and then try to give the fluid and electrolyte therapy, and then decontamination, that is mainly for the gastric lavage when the poison is taken ingested, and to know about the specific antidotes available for that poison if the poison has been identified, and then non-specific pharmacological antidotes like anticonvulsants, and how to promote the elimination of the drug from the body. That is, as I told you, accumulation, that is the accumulating of the poison substance in the body. And then the final thing is by the hemolysis or the peritoneal dialysis. How we are trying to, that is by using artificial kidney, removing that toxic substance, that is the fluid, directly from the body by using artificial kidney, and general supportive and nursing cares. So these are some of the steps involved for the general principles in treatment of poisoning, or we can say it's a management. Instead of treatment, we can say management. So first we have to identify the poison. So once you identify the poison, then you can go with a selective antagonist, may be helpful. So we know if that is the poison, we can go for a selective antagonist. When you don't know what is the exact poison, then it is not difficult. It's difficult to identify. Then ensure and maintain a clear airway, as I mentioned. We have to remove the debris, vomiters, mucus, which is present in the mouth, or suck away the secretions, which constitute endotracheal intubation, if necessary, through tracheostomy. And then if you see, ensure adequate ventilation, as I mentioned. We have to know that nowadays we go with the mechanical ventilators. So in COVID-19, we know what is the importance of the mechanical ventilators. So many mortality has been arised due to this. And underventilation may lead to hypoxemia, and overventilation may cause alkalosis and hypotension. So regulating this ventilation is also an important thing. And suppress convulsions. So normally what happens, if the convulsions are not suppressed by this adequate ventilation, then we have to go with a diazepam 10 mg should be administered in the adults. That is the second thing. And fluid and electrolyte therapy. So to restore the venous return or cardiac output, so we may go with the isotonic saline or isotonic glucose solution per day must be administered. And while administering this thing, we should record the urine volume and the fluid balance to avoid to manage the renal failure. And then decontamination, that is one of the important management when any poison is taken through oral. So gastric lavage, so this important thing, it should be done in a conscious patient, that is sucking out all the gastric contents. So there may be induced vomiting by using emetics such as apomorphine or a syrup of Epicat. And they may go with activated charcoal, because you know that it will be able to absorb, that is 10 to 30 gram in 100 ml water. If you don't know like that, we can go with the universal antidote, that is 2:1:1, with the charcoal 2 part and 1 part of tannic acid and 1 part of magnesium oxide orally. So that is the process of decontamination. So it should be done only in a conscious patient and not in a non-conscious patient. And if it is a corrosive substance, care should be taken. So these are some of the known drug overdose and what is the antidote to be used. So for example, it is in the case of the narcotic analgesics such as morphine. So we may go with the antidote nalorphine. It is a partial agonist. And is that in the case with the heavy metals? The antidotes such as desperoxim in case of iron, penicillamine in case of lead. So these act as a chelating agents. For anticholinesterase, we may go with the atropine. So this is acetylcholine antagonist. And for organophosphorus compounds, we may go with PAM, that is the prolactoxin, as a cholinesterase reactivation. So sometimes we may go with a non-specific pharmacological antidote such as analeptics. So that is they are called as respiratory stimulants such as the doxaprom, where they control over the respiration. And in the case of promote the elimination of the drug, we may go with the forced diuresis, and we have to maintain ionization either by increasing or by reducing the pH of the ion. So that is the urine. That's the thing it has been mentioned here. And the hemodialysis and peritoneal dialysis, it is based upon the patient condition that may be done in spite of a conventional treatment. As I mentioned previously, as artificial kidney to remove the fluid from the body where the kidney may not work properly. So therefore, these are some of the treatment measures which can be taken, and always the general supportive and nursing measures simultaneously should be instituted, especially in the case of a comatose or a semi-comatose patient. And some of the summary to remember in the general principles of treatment of poisoning: maintenance of vital functions such as airway, circulation, fluid and electrolytes, and maintaining the temperature. Elimination of the drug, either induced vomiting or gastric lavage, and other techniques such as forced diuresis or dialysis. Antidotes, if you know specific, fine, or otherwise we have to go with the symptomatic treatment. One care should be taken, never done with a corrosive agent has been ingestion, and never done in an unconscious patient unless cuff endotracheal tube in position. So these are some of the measures to be remembered in the case of the treatment of poisoning. And next, coming to the glimpse of some of the three poisoning, that is the barbiturate, morphine, and organophosphorus poisoning. So barbiturate history we see in 1864. It was founded by a German chemist, Adolf von Bayer, and it was used as an hypnotic agent in the year 1903. And then it is been synthesized for various activities such as convulsions and all in the year 1911. Coming to their actions, three types. One is long acting, intermediate acting, and short acting, and ultra short acting. So they have been used for surgery, sleep, pain, and migraine. And we know that their mechanism of action is acting through the GABA mediated chloride channel opening. When there is increase in, that is the overdose of barbiturates, what are the clinical symptoms? Can be seen is general ataxia, lack of coordination, physical dependence, withdrawal symptoms are more, difficulty in sleep, and in mouth you can see increased productivity of speech, slurring of speech. And these are so many things related with the mind, such as euphoria, irritability, confusion, delirium, hallucination, mood swings. So memory impairment. The causes may be, as I said, overdose may be due to drug addiction, it may be due to imbalance in neurotransmitters, genetic factors, or it may be a self-medication. Diet and regimen is fine. The treatment, what all I mentioned, the management is common for all the poison. Some medicines may be given for the symptomatic relief, such as cannabis indica, ISMS niger, but there is no specific antidote for barbiturate poisoning. Next, coming to morphine, you all know that it is from a opium plant, Papaver somniferium, and it acts through this mu, kappa, and delta receptor, and they are having a partial agonist and antagonist action. What I said, nalorphine, and this is the mechanism of morphine, where they directly inhibit the cyclic AMP pathway, or they promote the potassium channel opening, that is potassium channel, and inhibit the calcium channel opening. So that is the mechanism where it acts. And coming to the pharmacological effects, mnemonics to be remembered about morphine, the pinpoint pupil, the overdose, that is meiosis, orthostatic hypotension, respiratory depression, pain suppression, histamine release are that hormonal alterations, infrequent waste release, constipation, nausea, euphoria, and sedation. So these are some of the effects. And so here shown in overdose people's widening, central sleepiness, loss of consciousness, skin coldness, clamminess, muscle seizures, labored or stopped breathing. So these are some of the symptoms with overdose of the morphine. And as I showed you in the specific antidote itself, naloxone. So it is agonist of opiate receptor, and it can be used as an antidote for morphine poisoning. And coming to the organophosphate poisoning, so these organophosphate compounds, mainly it may be through the insecticides, diflos, pesticides. So they and all may lead to this organophosphate poisoning. The simple thing is that we have to know they're either a sympathetic or a parasympathetic. They bind in preventing the breakdown of acetylcholine. So they interferes with the acetylcholine receptors, either nicotinic or the muscarinic. So the various symptoms such as they were remembered with the mnemonics, dumbness, such as diarrhea, urination, meiosis, bradycardia, bronchospasm, emesis, lacrimation, lethargy, salivation, and seizures. And sludge, another mnemonic with that of the muscarinic, that is salivation, lacrimation, urination, diarrhea, GI cramps, and emesis. So these are some of the clinical manifestations of organophosphates. And if you see the antidote, that is the treatment, atropine, it may given a titrate dose for drying bronchial secretions mainly. And pralidoxin, it is a specific antidote which helps to regenerate the cholinesterase. So therefore, these three poisoning, we have learned about the barbiturate, morphine, and then organophosphate compounds, what are their clinical symptoms and their treatment. So next, coming to the heavy metals, so how they are named, when they're having a atomic weight higher than sodium, mainly, and having a special gravity density, that is, and it is being named as heavy metals. Normally, essential you call some as copper, zinc, non-essential barium, lithium, less toxic as strontium and aluminum, highly toxic, that is lead, mercury, and cadmium. It should be within the limit. And various sources of these heavy metals from various waste disposal, industrial smoke, corrosion, pharmaceutical fertilizer, mining, and like this, there are so many sources where it leads to heavy metal pollution. And coming to their symptoms, you can see systemic, chills, fever, pain, muscular weakness, liver decreased function, skill yellowing, interstitial diarrhea. Normally, you'll be seeing eyes yellowing, mouth of metallic taste, and circulatory anemic or shock, gastric vomiting, nausea, abdominal pain, kidney sometimes no urine production. And it is being shown here, it is affecting the various systems of the body, such as your brain, digestive system, nervous system. All these systems are mainly affected with the heavy metals. And this is the thing which is being shown here, the mechanism, how heavy metal pollution may lead to the cell death. This heavy metal poison may inhibit cell signaling, protein enzyme, DNA, and gene, where it may lead to impaired cycle, impaired conformation and function, impaired DNA replication, impaired transcription. Finally, it may lead to cancer or a disorder of a metabolism and its function, or abnormal and protein enzyme followed by death. And it may induce the oxidative stress or a protein, DNA, and a lipid, where it may lead to protein dysfunction, DNA impairment, or a membrane damage. So the treatment may be through a chelating therapy or a combination therapy with an oxidating. So that is mainly the chelation therapy. remove toxic metal and reduce oxidative stress, restore cell viability, then you can prevent from the cell death. So this is the mechanism. Mainly we are going with the chelating agents. So coming to the three important metals as per the syllabus, the lead, arsenic, mercury. So the form of absorption, lead, I have already told you, metallic lead, all with inorganic or organic salt, arsenic with inorganic salt or arsenic gas, mercury with a metal inorganic salt. So the route of absorption may be through lungs or GIT, mostly through GIT and lungs, and it is lungs and GIT. So mostly all are distributed through various parts of the body, mainly the bone, teeth, hair, liver, kidneys, and it crosses the placenta. So here it is in RBC within 24 hours, and kidney, muscles, and here also it crosses placenta, and in mercury with CNS, kidney, and blood. The excretion is very, very slow, maybe through urine or fecal, and it is very slow through urine and slow and urine. That's what I said. There is no urine flow in the clinical manifestations. So you can see the mechanism of toxicity of these three things. They may bind to the SH enzymes. In the three cases, in arsenic, it trivalent, it binds the thiol enzymes. And target of toxicity is heme synthesis, neuropathy, kidney, liver, intestine, reproduction. And in case of arsenic, it is bone marrow, neuropathy, kidney. It may affect this hemolysis also. In mercury, it may affect CNS, kidney, or GIT. And coming to the important part of treatment of poisoning, as I mentioned, then we may use a symptomatic relief as antioxidants, or we may go with the chelating agents. So for a lead, we may go with to stop the exposure to the lead, or we may go with the EDTA, calcium EDTA with IV, dimercaprol in case of intramuscular for children, or DMACA, that is in the less severe cases, dimercaptonic succinic acid. In case with the arsenic, you have to stop exposure or decontamination. We may go with the supportive therapy, dimercaprol, or we may go with DMSA, as I mentioned, or exchange transfusion and hemodialysis. And here also we may go with mercury. We may in this all these heavy metals we may go with the chelating agents such as DMSA, DMPS, that is dimercapto 1-propanophenolic acid, and hemodialysis in the case of the severe cases. And this slide shows about the what is the acute, chronic, and toxic concentration on the treatment, what we have learned in every case. So the acute may go with the mild symptoms, and the chronic we may see with encephalopathy, anemia, abdominal pain. And the treatment, what I mentioned, and the limit of the toxic concentration is also mentioned here. And with the arsenic, also the same thing. We go with the BAL, British anti-leukoside, and DMPS. And in the mercury also, we may have some of the different, the acute, and then coming to the chronic, and we may use the same treatment. So just I summarized what is the different types of heavy metal poisoning clinical symptoms and their treatment. So finally, coming to the conclusion, what is the need of this toxicity study? Why we have to know about this toxicology study? As they mentioned earlier, so we can able to know whether a useful drug only if it is having a relevant pharmacological and therapeutic activity. If it is having a relevant pharmacological and therapeutic effect, then only we will be knowing its toxic effect study. Second one, to know the drug which is having a relevant pharmacological and therapeutic activity, whether it is free from short and long-term toxicity. And then to know whether this drug, if it is superior in any way to the existing drugs. And finally, to know whether this drug is safe, and detailed studies are made to know the effect of varying doses at their prolonged administration. So that's why we are going for a long-term study. So keep in your mind, it will be useful for us to know the relevant pharmacological and therapeutic activity, and whether it is free from short and long-term toxicity, and whether it is superior from the available drug, and to know whether the drug is safe. So many clinical trials nowadays, including for the COVID-19, so many repurposing of the drugs and vaccines have been carried out to know the drug is safe and it is superior, and also to know whether it is free from toxicity. So that's all about my presentation, and I would like to thank you all mainly during this COVID-19. So any queries, you can go for discussion.
Thank you, Dr. Vadivelan. It was
Thank
a
you, sir.
wonderful presentation. And yes, obviously, we have a scientific session. There are some few queries from the students' side. And maybe the first question, maybe the person who's having more enthusiastic, why restricted animal usage in a B Farm UG level? So the toxicity studies is it required? We may eager to do that. Why it is restricted by CBC SEA? And then questions maybe immature to ask. Even the protocol it says that we cannot use in UG level. So what is your point of view, sir? What is your point of view?
No, fine. So it is, I think, I have mentioned in subacute toxicity studies, that is in toxicity studies, we were using more number of animals. We are using more number of animals and the mortality rate is high. So then they have brought the alternative systems of medicine. So the simple thing, if you're going and discussing with the animal care professional, they say one important thing is that we are doing an injustice to an animal. Am I right?
Yeah,
So
right.
you know that you call something as sentience and non-sentience. Sentience means feeling.
Okay.
So the animals are also having the feeling of pain and distress.
Okay.
So we should use the animals whenever it is required for a advancement in knowledge, for prolongation of life and all. So normally in our UG, it has been stopped from 2016 as per UGC and PC, because they have developed lot of alternative method of teaching these pharmacology practicals. So we can unnecessarily save some lives. Unnecessarily we can save some lives. And also they brought this 3RS concept. Normally you call 3Rs in animal testing. One you call it as first replacement. Replacement. That means in education system we are having the replacement. We can go with simulated experiments. Then they are told to go with, if you possible, you go for a refinement. Okay. So therefore, these 3Rs are considered to be important. That's why they have stopped it. But still, a dilemma is there. In research purpose, we are using, not for the education purpose.
Right. Thank you, sir. One more question from student side. There's a polyherbal formulations are frequently used, and the toxicity profile, maybe the polyherbal formulation having a synergistic effect. So how we can go for toxicity studies? How it is so accurate?
Okay, now when they are going for a polyherbal formulation, so as per my knowledge, we should know what are the ingredients in the proportion it is been taken. So already if you go through a review of literature, for that individual compounds, whatever the plant they are going to take as a herbal, so they might have studied the acute, subacute and chronic toxicity study. So in such a case, what happened? They can know the limit dose of that individual herbal extract. Once knowing the limit dose, based on the limit dose, either 1/10 or 1/100, 1/100th of the dose, they can select those drugs and they can prepare the polyherbal formulation. And when they go for toxicity studies, I felt you may not find the toxic effect. But directly mixing 4 to 5 plants and going for a toxicity studies is not entertained. Normally, it is not accepted also.
Okay. Sir, one more thing. The vaccine toxicity, does it require for the vaccine formulations? It is as per the regulatory guidelines. What it is, they are a little bit aware of vaccine toxicity in regulatory aspects.
So that comes under a separate perspectives. Okay,
Okay.
so I think what we are discussing that comes under separate perspective. So nowadays I don't want to mention some of the
Maybe the person who
we know
asked
that
maybe much more about coronavirus. There is so many
yeah,
vaccine
that's what the
development are
thing.
going on, and he may be over asked that
It
what will be
is
the
all are
toxicity
under
problem.
investigation. So normally
Okay.
what they do is vaccines and all cannot be carried with individual animal. It is carried by batch wise. So
Okay.
they will be seeing whether any adverse reactions with those animals when these prepared vaccines are tested. So it is given in our normal formularies also. They can check it.
Okay. Sir, Doctor, one more question. Can we conduct toxicity study using zebra fish? If so, whether IAEC is required?
Yeah, so we can conduct toxicity studies, mainly the reproductive studies with zebrafish. And nowadays, this IAC, that is, I can put in a simple word, zebrafish studies are under the purview of IAC. So they have to
Okay.
get approval also.
Right, right, right. Thank you, sir. It was a wonderful presentation, and especially there is a compliment from students that we are receiving response. Like
Yeah.
it was a wonderful presentation, very useful to us. Please arrange similar kind of presentation in future. So it's a good
Okay.
compliment for our institution as well. What you spoke, what you delivered today. So it's very well
Okay.
useful for all the students. And on behalf of once again, on behalf of our management and the faculty team and all our students side and the delegate side. Thank you so much for your accepting our invitation to present the topic. It was really very, very useful, and hope we may have a future presentation in future in our institution also, sir. Thank you so much,
Okay.
Dr. Dylan. It's your wonderful presentation. And now you want to say something to our students or something, please go ahead.
Yeah, fine. That's what I would like to openly say. When 15 days back, when you approached, then I was thinking what exactly we delivered for the students, because nowadays, if you go through the website, everywhere you're having the live webinars. Most of them,
Yeah.
what they do, just they click it to get a purpose of a certificate. Exactly, we may not be knowing we have attended and we are receiving the certificate. So I thought that for the beneficial of the student, it should not go off a waste, and exactly let them go related with their topic. That's what I have chosen a topic that is the principles of toxicology. And if we see the topic to be covered within 12 hours, I have not exactly taken a broad topic. I have just summarized for the benefit of the student.
Okay, okay.
So that's the
Thank you
thing.
so much.
Okay.
Yeah, please.
Yeah, carry on, sir. Thank you.
Yeah, thank you so much, Dr. Dylan. Once again, thank you so much. I hand over the session to Dr. Indulatha. Can you take over the session, please?
Yes, sir. Well, now we can conclude the session. We must thank Professor Dr. R. Vadivelan, sir, for delivering such a wonderful presentation. I hope it will be help a lot to learn about the basic principles of toxicology. Thank you, sir. Now I call upon Professor Dr. Nagaraj Perumal, sir, to propose the vote of thanks. Please, sir.
Good afternoon to one and all present here. I would like to thank guest of the session, Vadivelan, Sir, Professor, Department of Pharmacology, JSS College of Pharmacy, Ooty, for accepted timely our webinar invitation. I have immense pleasure to thank Dr. Periyasamy Sir, Chairman, Sree Abirami Institution, for his constant support, completion of webinar in a grand manner. Pleasure to thank our board of directors, Dr. or Senthil Kumar sir and Dr. E. Balamurugan sir are given valuable ideas for successful completion of webinar. I sincerely thank our Dr. M. Senthil Kumar sir, Principal, Sree Abirami College of Pharmacy, for his support and guidance for successful conduct the webinar. Once again, wholeheartedly thank guest of the session, Dr. Vadivelan, for his excellent talk and gathered with useful information about principles of toxicology. Last but not least, I thank organizing team members, teaching, non-teaching staff members of Abirami College of Pharmacy. Finally, My special thanks for participants of this events from various college students and staffs. Thanks to all. I handed over the session to Indulatha madam.
Thank you, sir.
Thank you.
So may I conclude the session with few words? More than 365 participants are registered across and out of the country. On behalf of Sree Abirami College of Pharmacy, we must thank all the delegates for their wonderful overwhelming response and the kind cooperation to this webinar. All of your e-certificates will be sent to your registered email ID in consequent days. Once again, I thank our speaker, Professor Dr. Vadivelan sir, for his thought-provoking presentation. And I submit my sincere thanks to our management and delegates, those who are participated in the webinar series 2, organized by Department of Pharmaceutics, Sree Abirami College of Pharmacy. Thank you, one and all. Sir, can we resolve the webinar, sir?
Yeah, thank you.
Yeah, thank you all the delegates. Thank you, Dr. Vadivelan. Thank
Yeah,
you, madam.
thank you,
Thanks
sir.
everybody. Thanks for joining all of us. Thank you. Have a good day.
Thank you. Bye.
Thank you for the participation. It will be appreciated to join our next webinar titled in Pharmaceutical Research, Opportunities and Challenges, to be held on 31st of July. Thank you, one and all. Thank you for your participation. Thank you.
Thank you. Bye-bye all. Bye.
Bye.